my, oops. So the first thing I would do is to know what they want from me. Okay, they want me to chart check every patient. They want me to know how to get to the ER. I know these are simple things, but I struggled a lot with that. Not knowing where things were in the hospital, not knowing anyone. English is not my first language. So for me, like, I didn't have any friends, connections, family members in town. So it was isolating.
Yeah.
So I would recommend to have the time when you start residency to walk around,
Okay.
try to form connections, know where things are located, and then
Okay.
play with the electronic medical records, because a lot of what they want from us as residents is what was the last hemoglobin?
Mm,
What did the CT show?
yeah.
And I didn't even know how to find those things in the chart. So,
Okay.
and I also was so scared of asking for help because I was like, what are they gonna think that this Mexican
Know
international
this.
student
Yeah.
doesn't know anything, right? So
Yeah.
being humble and asking for help and learning. And another thing that I would recommend is having a system. I
Mm,
tried a couple of things like writing down everything on post-its, putting it in a computer. At the end, for me, and I'm sure it's going to be different for everyone, I learned that putting everything on a list of patients and having a system of vital signs, labs, CTs, imaging, latest diagnosis, what happened overnight, and what is the plan for today. We want to discharge. We want to make sure the HIDA scan gets done. Like having that system helped me so much, but it took me months to
yeah.
get there. So I would allow yourself to be vulnerable, to ask for help, and to know that it's okay to not know everything and find your system, I would say.
Okay, great. So, what I'm hearing is one, you have to like know what is required of you in whatever role or position that you're in. By the way, is there anyone that is not a like in a medical doctor, I would say, in the house? Maybe you're a nurse, a PT, or something else like that. Please indicate in the chat so that we can also include you and you don't feel left out of this conversation, okay? But then if there's someone like that in the house, what we're essentially saying is the same thing that you should know what your role is, on the team, whatever team that you're on, know what your role is and be able to do that well. So what I'm hearing is it's not necessarily about being like the smartest person in the room. You have all the medical knowledge in the world. No, but like you have to know what you have to do and then try your best to do that. Yeah, have a system. Don't be afraid to ask for help. Be vulnerable and all of that. Okay, so that's beautiful. And like Dr. Gastelum has said, like I think the first few months of starting anything, maybe residency, medical school, residency, fellowship, even an attending, like when you're an attending, I'm sure you think, oh man, you finished residency, you finished fellowship, but then it's like you have to learn all over again. So taking all of this in keeping all of this at the back of your mind is very important. Good. So my next question is um as okay, we are not all IMGs, but for most of us are. So this my next question is more like tailored towards international medical graduates. What are some of the common like misconceptions that you have seen about IMGs? Or let me reframe that question and say like what could be like the barriers that we could encounter in the workplace that might like I don't want to say paint us in a negative light, but say that might be like a barrier to us doing our work well. What
Yeah.
experience, what do you think you've seen play out?
For me, what I've seen more consistently was the way we communicate.
Mm,
In my country, doctors are seen a little bit differently than how we see doctors here. Um, it was more like an authoritarian, like whatever the doctor says, you do. Um, so I was educated that way. And then when I came here, I started noticing that when my attendings went in the rooms, they'll be like, "Oh, good morning. What are you watching? I love that show." Yeah. And And then like we were supposed to talk about a heart attack, right? And then 5 minutes of just chit chatting, small talk. And then I also wanted to let you know that unfortunately you did have a heart attack and we have a plan. And I was like, wait, like, did we need all that small talk to begin with? But that's just part of
My
the
goodness.
culture.
Hmm.
Yeah. And that's something
Okay, so we
I,
are going to speak more about that later. Yeah.
yes. Yeah, but I think I then found out from my American graduates that they noticed that our way of communicating things was different. And I don't think it's right or wrong. It's just as IMGs, we have a different way of communicating ideas. And when we come here, we should try to adapt to that first 1 2 minutes of getting to know your patient, forming a connection, and then proceed with the medical stuff. And I know our time is so limited and precious, but if we really want to build that connection and help that patient in this country, most of the times is going to have to be through connecting first and then getting to the to the serious stuff.
Serious stuff. That's true. And like you know, going off of that, even with your fellow like co-workers, like your co-residents, your fellows and attendants and the nurses and everybody like that, um, it's very important to be able to like build some sort of rapport, I would say, with them. Like I'm going to use myself as an example. I'm an introvert. I'm more like keep it short, keep it simple, and keep it moving kind of person. And when I first started residency, I struggled a lot, and I was, you know, lucky enough to have a few of the nurses who were able to give me feedback, you know. And so I tried to like work on that, you know. I would smile more when I was walking on the floors. I would say hi more when I was walking on the floors. So you know, somebody asked in the registration sheet and they said, you know, what are some of the ways that you can try to like maintain you to like build that rapport with your colleagues, but still, you know, be authentic and stay true to yourself. Because let's be honest, not everybody wants to like, you know, chit chat, and we're all like different personality types as well, you know, different backgrounds, different upbringing, and all of that. So it can be difficult, but I think that, you know, it's something personally, it's something that I'm still trying to work on. And I think it's something that anyone going into residency, especially if you're just starting, to keep at the back of your mind. You know, it's important to build that rapport with whoever you're working with. So, also, I'm just going to like ask like, what are like apart from like the communication aspect, have you noticed any other like cultural like nuances or some kind of like unspoken, unwritten rule in the healthcare US healthcare setting that can pose like a challenge to the IMG? You know, are there any other like aspects of that you have noticed that we should be
Yeah,
aware of, you know, professionally?
yeah, I think just like how we connect into the systems. Like in America, at least what I've seen is everything is multidisciplinary.
Yeah.
You always have a doctor, a nurse, a pharmacist, a PT, and you all work as a team. And
Mm-hmm.
for me, that was new because I was used to just doing the medical part of medicine and then refer figuring it out. And here
Yeah.
it's a lot about communicating, and it's okay to text and call a cardiologist, which for me wasn't the case back home, and be like, hey, what are your thoughts on this troponin? Or showing something to the nurse and say, hey, do you think it's a good idea to go to CT now versus after lunch? Those type of interactions were not so common in my country. And
Mm-hmm.
coming here and learning that we're all a team, we are all the same, we all add value, and
Mm-hmm.
trying to be inquisitive with each person and saying, okay, I'm gonna get to know the pharmacist and hopefully learn more from them, or I'm gonna talk to my nurses and make sure they know me, they have my number, they have my pager, to learn to function within the system, which is new, at least for me was new.
Mm-hmm.
That helped
Yeah.
me a lot.
Yeah. So what I'm hearing is communication is a very, very like big and important aspect to thriving in a workplace, in a work environment, especially in the healthcare setting, because we work in teams like you've mentioned. You're going to be working with lots of people, different kinds of personalities, different kinds of characters. So learning how to navigate that and working on your communication skills is one very, very big point. So then I think another important point, and I'm going to like segue into, is leadership, which is also another very important pillar of standing out and, workplace excellence, as we are talking about. So, what are some of the ways that we can position ourselves for like leadership roles and leadership positions? What do you think, are some of the ways that we can demonstrate like initiative, taking up that, like, say, okay, this is me, I'm this kind of person, I'm going to be able to take care of this, I'm going to be able to handle this.
Yeah, so I think first couple of weeks or months, just knowing how the team works and your role, as we mentioned earlier. And then once you figure out your role within the team, start exploring what am I good at? And how can I show that I'm good at that? Because a lot of us are introverts, or we do our thing and then we go home. But sometimes to be a leader, you need to be a little bit out of your comfort and add those extra minutes of or hours of work to show that
Mhm.
you are committed. So being proactive is so important. Always within the teams are gonna ask like who wants to see the next admission or who wants to do morning report. And a lot of us want to go home, a lot of us want to rest because we're tired. But sometimes just saying, I'll do it. I'll do the next admission. I'll present about prostate cancer tomorrow. That
Mhm.
shows your initiative. That shows that you're committed, that you want to learn, that you want to give more. And
Mhm.
eventually doing those small things will alone position you as a leader. Another
Mhm.
thing I would recommend is helping. Sometimes you feel like you need to be helped as a resident because you're learning, but there's always
Yeah.
someone to help. There's usually a med student or another type of student that wants to learn. So showing something as simple as, oh, I'll take you to the ER. I know how to get there. I'll
Mhm.
teach you how to do auscultation on this patient. Those small changes eventually position you as a leader. So just volunteering that help and being proactive, I think will get you there.
Okay. And so one, you say like identify what you're good at, right? And some of us think that, oh, I have to be like, I have to have read all of this and I have to know all of that. But that's not always the case, right? Some people are better teachers than others. Some people are, you can be the kind of senior that you show your intern how to, chart review well, or efficiently. And there's different ways that you can show up in a team, like you've mentioned. But just to keep in mind, honestly, my number one rule of thumb is don't forget to be yourself, because we are in an ultra competitive, environment in medicine,
Yeah.
right? So as much as you want to, stand out, make sure that whatever you're doing it like genuinely, if that makes sense, right? So even like volunteering to do stuff, do it because you know that you're going to learn, because you know that this is going to add something to you and also to the team, right? So, and don't put too much pressure on yourself. That's one thing I think that I have seen that many people always do, because they are trying to like stand out, and it's understandable, honestly. But be kind to yourself, be gracious to yourself. Don't put too much pressure on yourself. So what, Dr. Gastelum, what are some of the, I'm going to put this way because, okay, let me just give, like, let me step back. People always like want to be chief, right? Let me see the chat if anybody mentioned that they are not like in medicine, so that like medical doctors. Okay. Okay, so I think we are all like medical students, residents, fellows, one thing or the other in the house. So yeah, um, there's only like three, four, five, and depending on how big your residency program is going to be, chief positions in a year, right? And some places it's like you have like an extra chief here. Some places you don't have an extra chief here, right? So that's like three, four, that's it, right? So, what are some of the other ways that a resident or a fellow, even especially, right? Because I'm PGY too now, I'm already thinking of fellowship,
Yeah.
applying and all of that. So, what are some of those ways, like what are those like leadership positions, like committees maybe that you think that one could like step up for and show like their leadership like position skills and all of that?
Yeah, so I agree. You can still stand out without being a chief. If you want to be a chief, go for it. I
Right.
personally was never too excited to be a chief because I thought it was a lot of responsibility on top of being a
Is
resident and a
yeah.
human. So my way of doing it was more joining committees.
Mm,
Um, Initially, I was a little hesitant because I was like, what if I don't get accepted? And I actually applied to a couple and I wasn't accepted. So it's okay to try and not be accepted and not get in the
yeah.
first time. Eventually, I was approved to one, which was the less desired committee. It was the wellness
Mhm.
committee. I was like, well,
Oh,
I'll start there, and it was such a great experience because once you join a group, you learn from other residents that maybe you didn't have the time or the
mm,
opportunity to work with,
mm,
and those interactions take you to other avenues. So I will first just get out of my comfort zone and say, okay, I'm gonna join a committee, whichever they take me, I'll go to that, even if it's not necessarily my passion, and
mhm,
start learning what it is to be into a leadership role. And again, what we mentioned earlier, being proactive, being a
mhm,
team player, and then eventually you'll find something you like. For me, I always knew I wanted to be an endocrinologist.
mhm.
So we had a lot of like cardiology interest groups,
Yeah.
oncology, but we didn't have an endo group. And I was like, what am I going to do? How am I going to stand up and become a leader in my field if it doesn't exist in my residency? So I created one. I
Mm,
was the founder of the endocrinology interest group, and I only had two other members. Um, but that really helped me because I became a leader and I created my own leadership position.
mhm.
And I had small events, and that helped me eventually get to other positions of leadership and teaching and things like that just by trying and not being scared of failing. Because I think a lot of us during residency were like, what if they don't think I'm good enough? Or what if
Mhm.
I end up for,
Yeah.
like the self
Yeah.
doubt and the imposter
Yeah.
syndrome that is always there. So
Yeah.
I would start just with being proactive, take whatever you can. And
Mhm.
if it's not wellness, it can be research, it can be scholarly, whatever your program has, just give it a try.
Okay, okay, that sounds great. And maybe this might sound like like a ridiculous question. What if I'm somebody that's just like, you know what, like I'm just not a natural born leader, like all these things, everybody's always like trying to shove leadership down our throats. I don't want to do that. I just want to
I
be
have
like,
weights for a couple of people.
come again, Priya? Ha-
I'm sorry. I'm sorry.
Okay.
I'm muting myself. Sorry.
Oh, okay. So what if, yeah, we have like, people, they're like, please no, I just want to, go to work, do my job, learn, teach my medical students or my interns, and, I'm not really cut out for this leadership thing. Um, is there any other way that they can stand out? Like
Yes,
that's
yes,
okay.
absolutely.
Yeah.
You don't have to be in front of a microphone to stand out.
Yeah.
You can find what works for you. Just if you're not interested in like public speaking or running a bunch of things where you have to talk
Mhm.
in front of people or
Yeah.
coordinate things, you can do your own abstracts. You can do your own manuscripts. You can have your own QI project where you don't even have to talk to anyone and everything's in the computer and everything's like a little underground, but still
Yeah. Yeah.
have meaningful work that
Mm,
impacts your present and also your future. Because a lot of us want to do fellowship or want to
Yeah.
get an academia position or something that requires those extra activities to be
Mhm.
in a better position when you apply.
Yeah. Yeah.
So if those things don't go with your personality, something will, because a lot of us remember that we are smart, we're so good at many things, but we are exposed to people that are so smart and extroverted and perfect that we're like, oh, maybe I'm not that good, but
Mhm.
we are. So we shouldn't
Mhm.
forget that we are bringing something. That's why they hired us, that's why they wanted to match with us. So
Yeah.
don't forget your value and just explore what makes you comfortable and pursue
Yes.
that.
Yes. Okay. That is, thank you so much for that response. Like, don't forget that you are valuable and there is something that you are bringing to the table. Like, trust me, if for maybe like the incoming PGY ones, or maybe you're already like PGY one, PGY two, I'm sure you know what the struggle is like. So it's very important to keep reminding ourselves of that, right? There's something that I can do. There's something that I can add. There's something that I can bring to this team that nobody else can. Okay. And I'm happy that you mentioned about research and all of that. And we're not really going to like, dive deep into that in this webinar. But another important aspect of thriving is what I'm calling this workplace excellence now. Thriving in the workplace is mentorship. And this one is very dear to my heart. So I am going to be asking, a lot of, quite a couple of follow-up questions. But I'm going to start with like, what are some of the ways that we can, build strong mentorship relationships, especially for one, like most of us are IMGs, we're coming from outside the country, so we didn't like really study here, so we don't have that like prior connection with some of the attendings, like say maybe some of our colleagues who may have gone to medical school and done some of their like electives and rotations in the hospitals. So how do we establish and seek out strong mentorship relationships in the workplace?
Yeah, so that's challenging, as you mentioned, when you come here and you don't know who wants to support you. So in the beginning, I would just observe and see like, oh, I really like how that upper level resident manages their patients, or there's this fellow who's doing the specialty that I want, that I look up to, and just keep them in mind, interact with them, and eventually, if you see that they support you and you can tell they like you and they want you to do
Yeah.
better, just take that leap of faith and say like, hey, would you have some time to maybe one day go down to the cafeteria and talk about how you made it into where you are? What did
Mhm.
it take to be a fellow? What did it take to be so good at presenting patients? So you don't necessarily need to say, would you be my mentor? But
Yeah.
you can just start with like, I really love how you do this, and I would like to be like you, or whatever
Mhm.
you feel comfortable saying.
Yeah.
That's one way, just peers. The
Okay.
other way that, because I'm sure you guys know, we can have all sorts of mentors.
Yeah.
Can be a co-resident, can be an attending, can be someone from Facebook that you look up to and you want to be like them. So I had some some mentors just from my co-residents and things like that, but I also talked to attendings who I never met. I wasn't supposed to work with them, and I just made appointments with them. And I said, "Hi, you don't know me, but I want to be an endocrinologist, and I'm thinking about writing this abstract, and I would like to have an endocrinologist as the reviewer. I will
Mm-hmm.
do everything. Would you be comfortable reviewing it and working with me?" I will
Mm.
tell you, a lot of them said no, but eventually
Okay.
someone will say yes. Someone will be like, "Oh yeah, let's do it."
Mm-hmm.
And then follow-up questions, can would you mind telling me how you ended up becoming an attending here? Just like being open to, again, be vulnerable and see who's celebrating your achievements. You'll have mentors that you ask for, and you'll also have mentors that choose to be your mentor, like that
Mm-hmm.
attending that just likes you for no reason and
Yeah.
chooses to spend more time with you and teaches you about things. They're also your mentors. So just give back and tag along, and yeah, that would be my advice.
Yeah. That's very good to know. And a follow-up question to that would be, um, if what do you like, what can somebody do if they are in, say, a kind of environment or residency program or whatever, and they feel like they just haven't found that person that they connect to or that they think can offer them that, like, mentorship relationship, or that support that they need. So how does one go about looking outside of one's immediate environment to establish um a connection with a mentor?
Yeah, that's a great question. I would recommend social media. We are so lucky to have access to millions of people. So establish an account on whichever social network you like and you think will help your career development.
Mhm.
And then once you identify someone, start interacting with their posts, start interacting, or I don't know, for me it was like I started following a bunch of endocrinologists when I was pursuing fellowship.
Yeah.
And then I would like their post and like comment if I thought those things were interesting.
Mhm.
And one day I had this attending who was in Arizona when I was in Nebraska, and I was like, oh, he sounds like he wants to help people, and he publishes
Yeah,
all
yeah,
these cool things.
yeah,
And I was like, you know what? I'm gonna message him. And I was like, I hope that doesn't come off as weird or anything. And I was like, hi, nice to meet you. My name is such and such, and I would like to talk to you about how you ended up doing this. And
yeah.
he accepted. He gave me a call, and I
Mm,
was so surprised that he talked to me for like an hour over the phone. He gave me so
wow.
much advice about how to, and he went through my whole fellowship application as a stranger. I've never
Wow.
seen him to this day in person, and he helped me so much. So that's a success story. I also message other people. I remember messaging a person on Instagram and I told him, hey, I'm an IMG, and he was like, what do you want from me? And I was like, oops, okay, it's not gonna be through this avenue. So just trial and error, but
Mhm.
I would say social media.
Yeah, okay, that's very good. And I am this that question was from me personally. And yes, I have been trying, and you'd be surprised. Like even like prior to residency, that was what I did also. I just like put myself out there on Twitter. I never used Twitter, but that day I said, you know what, I have nothing to lose at this point. And I did, and somebody, replied my message and asked me to DM him, and I did. And, long story short, that was how I matched into residency.
Wow, that's
So,
amazing.
it's like anything can happen. Just like, put yourself out there, put in the work, and just commit everything into God's hands. Okay?
Yes, I
Yeah.
agree. And I would also like have a professional account. Like we
Mm,
all like memes and cartoons and funny things, but I think we should be a little bit mindful in separating those two
yeah.
accounts.
Yeah.
And because I'm sure we all do that. We all have a Twitter or a Facebook where we have like this picture
Definitely.
with a suit and things like that. So yeah.
Definitely.
Yeah.
Yeah. So, I think, yeah, we're gonna be rounding up soon. And my last question, at least from me here, we're still gonna go into like a quick Q&A session. The last question is, do you have any advice to anyone that is aiming to match into a competitive fellowship program, or anyone, say, looking for like to be in academic positions? Like, some people really love teaching and want to be like, professors or associate professors in the nearest future and all of that. So any advice to anyone looking to go that route?
Yes, absolutely. I would first start just sitting with myself and asking, what is my goal? Okay, I want to do such and such. This is my specialty. And then thinking about where I am in my career. Am I on my first or second year? How many months do I have? Then once you have a timeline, or if you have 6 months or 18 months, identifying who could help you. As
Mm,
we just talked, it can be a
yeah,
co-resident, it can be a fellow, an attending, and
true.
then just sitting with them and saying, okay, I know you are successfully a fellow now. What did it take? How many abstracts did you have? How many publications? Did you have your own QI, or did you tag along with another QI?
Mm-hmm.
Did you volunteer? Did you write any book chapters? Did you present during morning report or grand rounds? Who wrote your letters of recommendations? How many letters did you need? What was the timeline of the letters? Should I ask him now or should I wait the month before? Really,
Mm,
really have a game plan. And
yeah,
I always try to have at least two extra letters of recommendation in case someone gets sick. Or I remember during residency my letters were coming from Texas and they had a hurricane, and a lot
oh,
of my my letter writers couldn't write them
yeah,
because they didn't even have electricity.
yeah.
So always have a backup plan.
Busy. Yeah.
And then another thing will be money. You're gonna have to spend thousands again, so just have that budget and say, okay, I think I'm gonna go for 50 or 100 200 programs. I'm gonna start setting that money aside. I'm gonna save money for my interviews. And
Mm,
just like you did for residency, another thing I would do is have someone who can review your documents. For me, English is not my first language, so I struggled a lot with my personal statements because they were very serious and not very touching. So
yeah.
I would always have at least a couple of people review my letters, my personal statements, and then also the most important thing that I think a lot of us overlook is your ERAS application. How to make sure what you're writing, once the person who's reading it, for them to want to talk to you, for them to want to meet you, and not only just like add links to your abstracts, but
Yeah.
whenever you have the opportunity to write something about yourself, show how interesting you are. Because at the end, we're trying to convince him to want to talk to us and give us an interview, right? So have people review your application and make sure you have a strong application.
Okay, that's good. So I'm sure everyone like already, if you've gone through the residency pathway, you already have an idea of this. But I think what's most important that you've just mentioned is about having that like goal and planning ahead. That's like the best thing that you can do for yourself. Information is power, knowledge is power. Ask people, ask other residents around you what they are doing, ask other fellows what they did, ask your attendings what they think you should do. Just ask, 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 and as much as possible, as much as you can, do. So not just ask and yeah, forget about it. You also have to, that's just like the truth of the matter is that's the field that we're in, that's the work that we're doing. You have to put in the work, you have to put in the effort if you want to stand out, if you want to be excellent, if you want to, push yourself. Like you have to just put in that effort. You can't just like sit, fold your hands and smile with everybody and hope that, oh, that's it, right? Except you're not down for all of this, then fine, you can do nothing and be done with residency and it. But if even during residency, if you want to like um stand out, if you want to be excellent, if you want to thrive, remember that it takes effort, it takes hard work. And in the midst of all of that, you also have to just remember to pace yourself, be kind to yourself, be gracious to yourself, because residency fellowship, it's already hard enough, right? It's already hard enough. And I know that this is not really in line with the the theme of our webinar for today, but I think you mentioned earlier that you are currently on the J1 waiver, and so can you just like quickly run us through, because I'm not sure, there might be some fellows in the house, and this is like future advice for myself.
Yeah.
Can you just like run us quickly through that part, especially for people who are going to be like what one applying to fellowship, and to say people who are just not gonna do fellowship, from residency, they want to like figure out, how to go about that whole
Yeah.
pathway. I know it's like visa and all of those things, and it's not really our topic for today, but I figured you could have some like, you have some idea and knowledge, and some of us would like to know about that.
Yeah, and I remember being so confused when the time came.
Mm-hmm.
So um I'm going to start by saying that it's again planning ahead. When
Yeah.
you are on a visa, on the J1 visa, you need to switch visas to an H1B visa. That is called a waiver because it means that when you finish your J1, you have the option of going home for, I want to say, 2 years and
Yes.
coming back with no obligation, or staying here for 3 years with an obligation of serving an underserved zip code community.
Hmm.
So if you waive the option of going home, you do your waiver in an underserved community.
Hmm.
And once you decide you want to do that, you need to have a contract signed and start the process a year before you graduate.
My God.
So
Yes.
for me, my fellowship was 2 years, right? So my first year of fellowship, I started looking for jobs, and my attendings were like, "What? You don't even know how to be an endocrinologist yet? Like, why are you looking for jobs?" But that's just how it works. I
Oh,
told them, "Sorry, I need to take a couple of weeks off to travel around the country and find a job."
wow.
So
I
once you
did not
start
know
looking,
this.
yes, it's a timeline because I don't know how much you want to know, but the each state opens like 30 slots, a little bit more depending on the type of waiver you choose to do.
Mhm.
And the applications usually open September, October. So if you think about it, you need to start in October, but you just started residency the previous July.
Mhm.
So you have to take that into consideration. So you have a signed contract by the time September, October comes, you can submit all the documents. The
Uh,
hardest part for me was finding the waiver because I wanted to stay close to California because it's close to Mexico. To me, that was important. I'm sure we all have our preferences. Um, so once I interviewed and I found a place that I liked, the lawyer did everything. Honestly, my process was very smooth. It was
mm,
mostly finding the job and then being
okay.
patient. Compared
Okay.
to residency, where I had to do a lot of the steps and getting like a statement of need and all these things that I
Yeah.
did on my own, when you become an attending, they want you, which was the first time for me that they wanted
Ah,
to work with me compared to when we
nice.
are always begging to get a job.
I know,
Um,
right?
it was so nice. They're like, we can fly you, we can pay you a
Oh,
hotel. And I was
okay.
like, oh my God. So it's going to be nice. I can tell you that. You'll have options and just start thinking about like, do I want to do academia? Do I want to do private practice? What salary do I feel comfortable with?
Mm.
And if you have questions, you can let me know.
Okay, good. That's like good to know. Like plan, 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 plan,
Plan,
guys.
plan.
The long and short of it all. So
Yeah.
we've come to the end of this session. Now we're going to be going into the Q&A. So how are we going to do this? I think you can like raise your hands, I guess, if anyone has a question, or you can type it out. But I think like just putting up your hands and coming on to ask the question would be easier. So in case there was something that we didn't cover and you want to know about, now is your opportunity. And thank you, Margaret, for showing us your beautiful face. Any hands up?
I see a question on the chat. It says, does serving underserved communities necessarily mean going to rural areas? That's a great question. And the answer is no. You can still be in a major city. It all depends on your HPSA score, which means this is, I know this is a lot of information and I don't mean to overwhelm you, but every zip code in our country has a score of how much poverty, how many patients are on Medicaid, how many patients are on Medicare, and there's an institution that gives them a score. I
Mm,
think if the score of that zip code is, I want to say 7 or more, it qualifies as underserved. Even if
mm,
you're in the middle of Manhattan, but there's a lot of people in homeless situation or poverty, it still counts as a waiver. So I didn't know this. And I assume I had to go to this teeny tiny town and that was my only
yeah.
option. But no, look into the HPSA score, and you can stay within the city. You can stay within large academic centers as long as the location is underserved.
Okay. Yeah, I think that's because like I stay in Newark and we are an underserved, even though technically Newark is the largest city in New Jersey, but it
Yeah.
is an underserved area and it's just like right next to New York and yeah.
Yeah.
So
Yeah. And another thing is, let's say where you do residency is not an underserved zip code, but a satellite clinic 10 miles away from there is
Mhm.
underserved. You can work for, let's say, Harvard, but work in the satellite and you're still
Uh,
considered underserved.
yeah.
So your lawyers will know, but there's also a way of like, there are maps online where you put the locations that you like and they give you the scores. And I remember just checking the scores in California and randomly calling clinics and say, hey, do you do J1 waivers? And that's how I ended up finding one place where I ended up creating my waiver job by telling them, hey, I want to work here. I know you haven't done a waiver. And we ended up doing it. So don't be shy of creating your own path.
That's good to know. I think there's one more question. Okay, so there was what
Yes.
software or search engine did you use to find jobs?
I use Doc Cafe, Practice. Oh my God, I can't remember. It, someone told me the names. And I remember getting a recruiter. Recruiters make money when you sign a contract, so they want to help you. And when you're so busy with fellowship or residency, you want to get that help. So I'm 100% sure once you create an account in these websites, I'm going to try to get you the names later.
Yeah.
Um, so a recruiter is going to reach out to you. Then I will interview with the recruiter and say, these are the locations I want. It
Mm,
has to be a J1 waiver, or it doesn't have to be a J1 waiver. And I want, you know, your requirements. Like
mm,
I want it to be a big center. I want to be in the outpatient setting. And the recruiters do a lot.
mm.
That was one of the ways of searching. And the other way was just through word of mouth. Like I told my program director, the chief, hey, I'm starting to look for a job. I know it's very early, but for me, I have a different timeline.
Okay.
And I ended up finding the job I have through the chair. The chair
No.
was like, oh, I have this friend who has a clinic and maybe you can talk to them. And they connected me to the owner of the practice. So just again, don't be shy and just say, I'm looking for jobs. If anyone knows someone, let me know.
Okay.
But for the search engine, I'm gonna get you the name. I
I
think
think
it's
someone put
practically.
the practice match, practice link, Doc Cafe. So
Yes, these are the ones I
Dr.
use.
Dr. Uba
And
put
then
the
you'll be overwhelmed. They're gonna send you so many messages. So just be kind to yourself. Don't try to set too many interviews because it can be a
Mhm.
lot.
Okay. Thank you. So, another question is how does one maintain healthy boundaries with co-residents and faculty? And I'm
Mhm.
going to like piggyback off of that question because in a quest for trying to, I don't know, be liked, because everyone wants to be liked, right? You want to work in an environment where you feel like people like you and you like the people there. But yeah, there comes a time where you have to this is too much TMI, too much information to volunteer or too much information to give to me. So how do you maintain healthy boundaries with co-residents and faculty?
Oh God, that's so hard. I think it's also trial and error, like learn the culture. I remember my first job in the Midwest, people just like are very, they volunteer a lot of information to you. And I wasn't used to that. So I was like, oh, TMI. But eventually I learned that that's how the city and the staff worked.
Their way of life.
So, yes, yeah. So I think first learning the culture, which is going to take you months to understand the inside jokes, the accents, all those things. And then once you eventually, unfortunately, are going to have a microaggression or something that makes you feel uncomfortable. And that's when you can learn your boundaries and say, oh, I didn't feel comfortable with that. And next time that happens, I'm maybe not gonna laugh about that because to
Mm,
me, I'm gonna give you this example. I had this attending who was different and made some comments about my country of origin that made me feel uncomfortable. But since I was new, I didn't stand up. I said like, ha 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 ha, ha, okay, like you're new, you're naive.
Yeah.
And then I went home and I was like, oh, I didn't feel comfortable with that. I don't think I'm gonna let that happen again. And then whenever I had another interaction like that, I just said it. I don't feel comfortable with that. And
Mm-hmm.
that was my boundary. Did they like it? No, they didn't. But I
Yeah.
created a barrier of respect where, like, this is where you end. So
Mm-hmm.
sometimes we all are going to have these interactions where we don't feel comfortable. And unfortunately, we just have to be honest and say, I didn't appreciate how that was worded.
Yes, yes. And just going, adding a little bit more to that because especially maybe if you're like Hispanic, African American, or even African, there's going to be some like, biases, and I don't want to use the word discrimination. Though maybe there would be some rare occasions of that.
Yeah.
You did your residency in Nebraska. Well, but maybe Omaha is like a bigger city, so I'm not sure. But like I'm in Newark, New Jersey, so there's a little bit more of like a melting pot here, but still, there's some, biases and stuff like that. And you're just gonna have to like learn how to one, identify these things when they happen. Two, know how to like respectfully like, put a boundary in place. There are sometimes where you have to like speak up and say, respectfully, like, I'm not comfortable with this, like Dr. Gastelum said, or you might not go to the person directly. You can go to like your chiefs or your PD, your program director, and discuss with them about this. But ultimately, I think because I have had a situation where I I had it up to here and I finally went to, speak with my ICU director about this because it was an incident that happened while I was on my ICU rotation. And I felt like I did not get the support that I needed. Instead, he took it up to my program director, and I felt betrayed. So
Yeah.
you're gonna have like, unfortunately, you're gonna have like situations and circumstances like that. And this is where that how do I put this in? Like this is where having that like community outside of work, so to speak, like your support system is going to come in and play a huge role, right? You're going to, you need your people, like I like to call them, right, to blow off
Mhm.
some steam and just like recalibrate and keep it pushing, right? So you address what you can address is what we're saying, and some things you're just gonna have to like keep it moving and chin up, right? I don't know if I'm
Yeah.
giving the right advice, but that's
Yeah.
that's how I feel about it, at least in my little experience working here. So yeah, I think how can someone okay. Let's see. The next question was, how can someone find meaningful mentors while on the USMLE journey? Can you share any useful tips? PS, my interests are pediatrics and family medicine. Okay, so I guess this person is still, trying to match into residency on that journey. So, okay, but before we answer that question, I'm just gonna quickly take Dr. Uday's question because it's like in line with what we are previously discussing. Did you use your own independent lawyer or a lawyer from the hospital?
I use the lawyer from the hospital. In my case, it was a clinic, so I use their lawyer. But there are a couple of instances where you're gonna want to have a lawyer review things. The first one is just for the whole process of getting the visa, but before that, if you have the funds and you think it's good for you, have someone analyze your contract. So that will be with a contract lawyer, not with an immigration lawyer, because
Oh my
I mean,
gosh.
I contracts are I know contracts are hard. The words they use is like when we talk in medicine that people are like, what did they just say? Contracts are like that. So they gave me this formula like if you see this amount of patients, 40% of the salary is gonna become a bonus, but you have to reach this amount of dollars. And I was like, I don't know what I'm doing here. I don't know if they're scamming me or they're paying me or what. So just use your resources, set some money aside so you can have a contract lawyer review your contract.
So you're gonna have to have more than one lawyer, it seems, is what you're saying.
Yes, which sounds overwhelming, I know. Or if you have a friend that you trust and they know about contracts, you can also do that. I just wouldn't do it on my own.
Okay. Okay then. And yeah, Dr. Praise is asking if you have any good contract lawyers that you can recommend. I think if you can just like put that in the chat.
Yeah. Hmm. Yes.
So moving on, yeah, back to Dr. Wankocha's question. Yeah, how do we find a meaningful mentors while on the USMLE journey?
For me, it was finding someone who's in that journey, someone who just much interested in someone who is an attending now. I remember what we were talking about earlier, messaging people randomly back in the day, because it's been a while since I matched.
Mhm.
Um, it was through Facebook or word of mouth, like, oh, I heard that person from our school is in Los Angeles now. Can I have their number? And just blindly be like, hey, I need
Yeah.
help. So just finding people who are going through the same, and again, a lot of them will reject you or ignore you, and that's totally fine. I'm sure they're busy through situations in life, but one of them is going to help you, so
Yeah.
just keep trying.
Yeah. And that's like definitely like Dr. Mokecha, that's what like groups like these, Women of Faith in Medicine, that's what we're here for. Um, just alone in this group, you're going to find tons of people who are ready to like volunteer help, volunteer information to you. We have a USMLE study group that we just formed. We have people that just matched from this recent cycle that you can reach out to. You can reach out to me. You can reach out to any of the team leads.
To
If you have
me.
questions, you can reach out to Dr. Gastellum. You can reach out to any of our prior hosts. So, like that's literally one of the pillars and the idea of our group. It's to like provide help on this journey. And yeah, so also you're asking about networking for USCE. That's like clinical experience. It's all like intertwined, right? It's the same thing. I feel the same thing you're gonna do for like say research opportunities or for mentoring opportunities. It's the same thing you're going to do for like USC, right? Reaching out to people online, asking them if they know whether they do like clinical rotations at their hospitals, just asking for someone's like program coordinators like contact, and you email these people, right? Because looking at the hospital website sometimes, like you've mentioned, it's not very encouraging, and like the information is not always like up to par there. And even if the information is there, like sometimes it's like, having someone like just go knock on program coordinators and be like, hi, I have a friend who sent in an email. Can you please take a look at it? Something like that. It can make all the world of difference. So yeah, reach out to the people in your circle, like any senior colleagues who have already matched, who are already within the system, ask about like clinical rotations at their places, email doctors, like there are also, some doctors that like have students come do like USCs at their clinics. And yeah, so it's like tons of ways you can go about it. It's not just about like looking at hospital websites. And the best way that you can start so that you don't get overwhelmed with yourself is to start with your circle. So who are the people around you that you know? And then you go from there, you expand your radius from there.
Yeah,
I
and another good way is outpatient clinics.
Yeah.
Sometimes we go to big names, and most of the big academic centers now they know that it's profitable to have international students, so it can be very expensive.
Hmm.
And sometimes you can reach out to small clinics and talk to the HR department and say if you could do an observership. And you will be surprised. A lot of the doctors want to have a learner with them, just watching what they do. I recently had someone reach out to me, a med student, and I was like, sure. And they just have to go through like an HR procedure, and then they get to work with me. So try also with clinics, private
Yeah.
practice.
Yeah, one thing I've learned on this journey is like you'd be surprised the like people who actually like are gonna help you, right? So
Yeah.
just shoot your shot for a lack of words.
Yes. And don't
And
be scared of rejection.
yeah, exactly. Don't be scared of rejection. Okay, so let's see. Do we have any more questions? I think that's all we have here from the Q&A session. And I think that brings us to the end of today's session. So thank you so much, Dr. Gastelum. It was so nice to have you. And I am definitely going to be reaching out to you, especially regards this whole like J1 waiver like process, because yeah. Um, and yeah, we're so glad. I hope that every other person here has been able to like learn one thing or the other, because I definitely have. And if you guys, last chance, any other questions? If we don't, I am just gonna hand the floor over to Damilola. Dami, am I handing over to you?
No, Eugenia, thank you very much
Okay,
for
I'm
saying.
handing over to you, Junior, then.
Yeah, so even though I'm not practicing in the US, I was able to learn some things, especially the at the beginning, being proactive, you know, as an IMG, it's a different world. Yeah. For me, it's always I am an introvert and also the language. So you just sit back and you don't do anything, but we have to be out there. We have to try to be friendly because it's not all about your manpower. It's not all about what you can do. Focus on what you can do and be friendly because we definitely need people to go forward in life. Yeah. Thank you so much. Thank you so much for honoring us with this meeting. Thank you so much to our guest speaker. Thank you so much. Thank you for your time. Thank you for pouring out so much to us. And we are so, if you have been blessed by today's meeting, like if you learned something, please like say something to our guest speaker. Say thank you. We really thank you. We appreciate you. We appreciate you a lot for doing this for us. We just thank you so much.
No, thank you so much for allowing me to get to know you and share some of the things I've been through. And just don't forget that I'm here. If you
Yeah,
have
that's nice.
questions, if you need any sort of advice or just motivation, let me know. And I also want to thank my dear friend Faith, who I had the pleasure to meet in Nebraska and who invited me to this group.
Mm,
She's such an amazing human, and I'm so glad that she helped me connect with you guys.
Thank you so much, Faith, for the connection.
And
Thank
for
you
the
so
future
much.
endocrinologists in the house, this is your opportunity to,
Yeah.
to build that like connection and relationship with
Mm,
someone that has gone ahead of you.
yeah, thank you so much. For announcements, let's not forget that our next meeting is going to be May 10th, and that's a prayer meeting. So let's add that to our list of activities to do. I'm really grateful that we are gathered once again. So I'm going to just end with a close.